Well, good morning, everyone. You are very welcome. It is Friday, the 20th of March, and we begin this talk today by realising that the pandemic is now well underway and will be getting more severe in the coming days and weeks. And I want to start off this morning by looking at some graphics. Now, these are just sketches I've made, but they're on proper data. So what we have here, this is the number of deaths up here, 1,000, 2,000, 3,000, 4,000. Now this was the pattern in China, in the green line. Started off with a small number of cases in Wuhan, and that gradually picked up until it reached 3,245. 3,245 deaths in China. So we saw a gradual increase in the number of deaths. Now the red line is Italy, and the number of deaths has increased dramatically in Italy and has reached the terrible milestone of now exceeding the number of deaths in China. Now I want to look at some other graphs as well today. Now this is the South Korea situation here. It's topped out at just over 8,000 cases. So these are thousands of cases in South Korea. And what we notice here is that there was this increase. But South Korea was doing huge amounts of testing, quarantining, contact tracing and social distancing. So the number of cases here has levelled out, actually started going down. There's been a few clusters of cases just recently round about Seoul, but they're being contained. So the South Korean situation, we actually see quite a degree of successful containment there, because as we've looked at before in this video, global containment now needed. So that's South Korea. Now China, now I'm not going to debate about the accuracy of data from China. We believe it's reasonably accurate. Governments around the world believe it's reasonably accurate. So these are the thousands of cases, 20,000, 40,000, 60,000. And we had this increase here, dramatic increase at that point there, probably due to cases leaving Wuhan. But then when the implementation measures started here, the testing, the contact tracing, the quarantining, the social distancing, it all went down. And the data is, the reports from China at the moment are no new cases in China for the past 2 days, apart from backflow cases from people that have been overseas. So the new cases in China from backflow cases from overseas, not new spread in China. Now, this is the position in Italy. These are number of days since 100 cases. These are days along the bottom here. Now, again, we saw a few cases following this pattern of cases, clusters, community spread. And now we've got this dramatic increase here. And this sort of pattern of increase basically is much the same in quite a few countries. So what we're seeing in these countries here, Spain, the UK, the US, France, Germany, Iran, we're seeing this fairly dramatic increase in cases in contrast to it's like the early stages in China or the early stages in South Korea before it was contained. Now, what's going to happen here is the question. So are these number of cases going to carry on? Is it going to be something like this, with exponential rises in cases? Or are we going to implement sufficient measures that we can copy the South Korean model and level the cases off and hopefully start reducing them? That's kind of the juncture we're at. So we're just here at the moment. So whether we go up steeply or not to more disease, chaos and death, or whether we can implement measures to level things off now is largely up to us and governments, up to us as individuals and up to us as governments. Now, I've got a few questions I want to just think through this morning, so I think we'll just talk through these before we look at some individual news from round about the world. Why are we fighting this virus? Some people have said, well, it's inevitable this virus is going to spread around the world. And yes, it is inevitable this virus is going to spread around the world. We are in a pandemic and it can't be stopped. But it can be slowed down. It can be massively slowed down. So we're fighting it to slow it down while we wait for a vaccine and while we wait for therapeutics and while we flatten the curve so that our health services can cope. And I'm glad to see that countries around the world now are improving testing. The World Health Organization says test, test, test. We can't fight an enemy we don't see. So countries like South Korea and China, where they've had huge amounts of testing, have also contained this epidemic, this pandemic. They've controlled the epidemic in their area because they've had plenty of testing, so we can see it. Now, you see, if we don't have testing, we don't know who's got the virus and who hasn't. And we looked yesterday at the antigen tests, which we now have, and the antibody tests, which are going to be coming online, I hope, within the next few days and certainly within the next week. The antigen test for the virus tells you if someone's got the infection now. The antibody test tells you if someone has had the infection at any point in the past. Because without testing, we have to assume everyone's got it and isolate huge amounts of the population. We have to have what we call a high index of suspicion if we don't have the testing, and assume that people have got it. And people are unlikely to stay off work if they think, well, I might have it, I might not have it. But if they know for sure they've got it, then they're more likely to take appropriate action. So we need this global testing to be massively stepped up. Now, I'm constantly asked how long can the virus survive on surfaces, and the data here is not definitive, but it does depend on the surface. So hard surfaces, it can survive on hard surfaces as long as it's not in direct sunshine. We'll have to assume for 3 or 4 days. So days is the answer. We don't have a precise figure. It will depend on temperature and humidity. Soft surfaces like fabrics, probably only a few hours. But we have to assume the answer to that question is days. So we have to assume if someone's had the virus, or even in a public area, we have to assume our hands are contaminated, and we have to assume that contamination can be picked up from surfaces days later. That's the only safe way to proceed. So the answer we believe to that is days. Now, I'm constantly getting asked, can this spread in air conditioning? I think this depends on how good the filtering is in the air conditioning system. Now, air conditioning without filtering, I'm sure the answer to that question is yes, it can spread in air conditioning. Generally, we have to be within 1 or 2 meters of someone because it's mostly droplet infection. But this virus kind of occupies a space between a droplet infection, where it's only in big droplets, and an aerosolization, where it's in much smaller droplets and can hang in the air for a period of time. So closed environments like ships or aeroplanes, where people are close together, there's going to be a higher risk of spread. So air conditioning without filters, yes, I believe that is a risk factor because we do get some aerosolization of the virus. But generally it is a droplet infection, and generally it's a meter or 2 of relatively close contact, or physical contact, of course. Now, for years I've been teaching students about sexually transmitted diseases, and I say that what matters is not so much how many partners you might have, but how many partners a partner's had. So if you've never had a partner before in your life and you have one partner, but he's had 1,000 partners before, then you're exposing yourself to massive risk. And of course, it's the same with this virus. So you might be self-isolating at home and one person comes to visit you, but how many people have they come into contact with? Potentially hundreds or even thousands. So we have to think about these chains of transmission. A can go to B, can go to C, can go to D, and it can spread out in a fan-like way. So we have to practice rigorous social distancing for the next months all over the world. It's the only way to stop the spread of this virus at the moment. Now, vaccine claims are starting to irritate me, to be quite honest. People are saying there's going to be a vaccine next month or in 2 months, or a new vaccine has been invented. Well, actually, there's about 20 or 30 vaccines have been invented. It's not hard to invent one. The microbiologists and the biochemists did that several days after in fact, some did it the day after the genome, the RNA genetic sequence was released from China. And people were saying, well, we developed a vaccine overnight. Well, this is just so misleading. Because, yes, you can develop a vaccine, but it's going to take a year to test it. So we are not going to have a vaccine in your city for nurses and doctors to inject into people's arms in 2020. I hope I'm wrong, but I really don't think I am. So the vaccine is not coming along anytime soon. I suspect it's going to be at least 12 months from now before we have a readily available vaccine. And if we get it that quickly, that's incredible. So at the moment, we need testing, we need contact tracing, we need quarantine, we need social distancing. That's our only weapon at the moment. Eat plenty of fruit and veg. I'm advising that as well. It's interesting that the panic buying in my country, I must say, as I found it pathetic, really. People buying up toilet rolls. I mean, it's actually funny if it wasn't so serious. People buying up pasta and tin foods, but yet the shelves very often are full of fresh fruit and vegetables, which is exactly what we need. Now, my government in the UK has told me there is no problem with food supplies. The logistics are there, they're in place, the food is in stock in warehouses. I believe them. We don't need to panic buy, and I find it, I'm actually disappointed in some of my fellow citizens for panic buying, because it means I'm going to get all I need and stuff the person that's coming after me. It's just appalling. We need community movement. We need to do this together. It's not self. Because if someone else gets infected, that can get back round to you anyway. You know, even invested self-interest. Let's start looking after those around us and stop this panic buying, which we don't need to do, and eat plenty of fresh fruit and vegetables. And I'm taking my vitamin D. Now, I haven't had time to do an exhaustive review around the world today, but I am noting that there's been no new cases of domestic spread in China, which is believed by the World Health Organization and by me. And the 39 cases they have had are backflow cases. So that shows it can be done. Now, Hong Kong, people have been very careful for the past few weeks because, of course, Hong Kong is basically connected onto China. And, it's got a land border. So people have been careful for a few weeks, but now they're getting a bit bored with it and they're dropping the defences, and community clusters are now developing in Hong Kong. So this shows we are in this for the long haul, for the next few months. It's not a matter of just socially isolating for a few weeks, as they've done in Hong Kong, and then think, we'll go back to normal now. No. If you take away the social distancing, the spread will come back, and that tragically does appear to be the case in Hong Kong at the moment. So we need to be doing this for some months. So that's kind of the moral of that story. Now, the United States, the number of confirmed cases, again, we can multiply that by 10 quite comfortably, I think. Now, various people have been giving out messages to young people in the States, and this is good. Now, there's been young people behaving as if we're not in an emergency, as if we're not in a pandemic. We are, and by congregating as they have been, at least as we've seen on some videos from the United States, that they are actually basically condemning other people to death by doing this. Let's not mess around with language here. And as well as that, this is very disconcerting. Quite a few younger people in the States do seem to have got quite ill with this virus. So it may well be that the virus is affecting different populations with different lifestyles differently. I don't believe this is a genetic factor, but for example, the diet in young people in the United States is perhaps not as good in terms of eating healthy foods as the diet of young people, say, in Germany, for example, just to take a random example. I mean, I don't know this, but it's possible that these environmental factors could predispose to varying degrees of disease severity in different populations. So I am concerned that there are sicker younger people in the United States at the moment. Now, the United States is saying no overseas travel. We've been saying this for some time on this channel, haven't we? since February, in fact, since January probably. Really wish people had been listening earlier. The delay, the importance of the delay is going to be measured in human lives, unfortunately. Now, the governor of California has written to the President of the United States, and we can assume that the governor of California is well informed. He's expecting up to 25 million infections over the next 8 weeks. Now, this is an appallingly defeatist attitude. What he should be saying is over the next 8 weeks, we're going to have massive testing, contact tracing, quarantining and social isolation. That's what he should be saying. Or is it she? I don't know. Just to say we're going to get 25 million new infections. That's 50% of the population in 8 weeks. Is just not acceptable. We have to fight this thing. We're not just going to say, oh... I mean, I know that the governor's not saying this casually. I don't want to say that, but and I might be misquoting him, but I mean, the potential for 25 million infections in California is there, as it is all around the world, and the response has to be, let's fight this. This is not acceptable. I'm not going to accept 50% infection rates in my country over the next few months. I'm not going to accept that. We're going to fight it. That's what we need to do. The potential, of course, is there. And I don't need to keep reminding you that 12 to 15% of those are going to be quite ill. 4 to 5% of those are going to be critically ill. Do the sums. 25 million. Do the sums yourself. I mean, it's just terrifying. Italy. Heartbreaking scenes coming from Italy. Terrible scenes coming from Italy. An open country, modern country, good healthcare infrastructure, huge number of confirmed cases. The death rate climbed by 427, especially in the north, but all over Italy now. Italy their curve is ahead. Let's learn from it and follow the South Korean, China approach. Germany, the deaths in Germany are still quite low. This is going to increase. There's no question about that. Hard to say why the deaths appear low in Germany. There's been a lot of testing in Germany. So a lot of testing means they know about more cases. And we know that 80% of cases are probably going to be mild. So actually, the more you test, the lower your case fatality rate is going to be. Health services are very good in Germany, and as of a few days ago weren't overwhelmed, which makes a huge difference, of course, to your case fatality rate. UK, panic buying is pathetic. I'm appalled. It's pathetic. Key workers are allowed to take their children into daycare centres and are being looked after, which is good. Spain, hotels being used as hospitals. We are in this pandemic now. Now, we can't. This idea of the curves is just so important. It's just so important. So I'm just going to draw a few again. Right. So basically, in Europe, we are here like this. That's kind of where we are now. That's kind of today, about there. And this is going to go hugely higher. We don't know how high, but hugely higher if we don't take these social distancing, testing, quarantine, complete lifestyle change for the next few months measures. If we take these measures, then we can level this off. This is what we need to do. And then bring it down. And that will lower the curve. Without this, the curve is going to go way higher. Way, way higher. And in fact, yeah, so that's lower the curve. And the other thing is if we have if we imagine that this is a graph here as well. So here we have a graph here. Now, what we need to realise is that the curves in different countries are in different places. So if this is time going along here, and this is the number of cases here, then what's happened here is in Italy, they're going up now like this. But Spain, so that's the Italian, so that's Italy there. But Spain is just kind of a bit behind that. The trend is very similar, and France and the UK, again, France probably about here, the UK probably around about here. These curves are going up, but without interventions, these curves are all going to end up being much the same shape and rising to the same level of number of cases infected. So unfortunately, where Italy is now, other European countries could be in a few weeks. I'm just trying to say things to emphasise how important this is, that we instigate these measures now and take them seriously. So my bottom line today is life has to change from now on for the next weeks and months if we are to prevent these disastrous increases in cases.